His symptoms were head tilt, headache, a sinus infection that would not go away, nausea, dizziness, and then he had told me the night before that it was double vision. Mom, when I look at you, I see two.
We had to go to a basketball tournament that weekend, and that's when, because I was playing basketball at that time, when I was coming to the doctor, and every time they passed me the ball, I backed up because I didn't know what was coming at me until it hit my hands, and that was hard.
How many basketballs did you see?
2.
We saw Dr. Fisher then at like 2, and we knew then probably by 3:30ish. And I think I'd called my husband and said that, you know, there's something wrong. I said, we don't know what, but there's something wrong. And then the family came the next day then to the doctor, and then it just kept, I mean, it was just a big, huge roller coaster. It was huge. On Saturday, there were brain surgeons calling our house to try to set things up. You know, not their secretaries, not their assistants, it was the actual surgeon. And then we were supposed to be seen again on Monday at Gunderson, and then the surgery was actually like on Tuesday. And it was a battle because throughout the treatment and stuff, it was, you know, you constantly build him up for the next chemo round, and then you knock him back down. And, you know, so we did a lot of therapy because he ended up in a wheelchair. And we always used to say that it wasn't quite the 4-wheeler he anticipated, but, you know, you walk into the hospital and you come out in a wheelchair, 4-wheeler. But it was, you know, 9 rounds of chemo and 30 days of radiation, a 3-month hospital stay, like 3 days a week at the clinic for therapy, and just trying to put his life back together and basically live a life is basically what it's been. And you can't focus on the negative because you have to keep pushing forward. And that was my mother, because she kept at me. She goes, if you can't handle the whole picture, then you look at a little part of it. And if you can't handle that little part of it, then you go for a moment. And if you can't go for a moment, then you go for a breath. And that's what kept me going.
Well, this one going great. I think it's a lot better than most people, I think. But I really can't say it's been going great for me, because it's a lot of my friends, and they're not so great sometimes with the cancer, but I'm good.
You know, if you can make a difference in somebody's life, please tell them Kyle's story, because if we make a difference in one person, we've done our job. Because to me, that's what I want to do. I want to make it better for somebody else.